Endometrial hyperplasia. This is a patient-simulated task. The task assesses the following domains: information gathering, patient safety, communication with the patient, applied clinical knowledge. You are the ST5 in the gynecology clinic. Anne-Marie, 42, who was following up at a fertility center, as she has been trying to conceive for the past 2 years, has come to you with her endometrial biopsy report, which is showing endometrial hyperplasia with urtypia. She has been having heavy menstrual bleeding for the past 6 months. She wants to discuss the report with you. Your task is to take relevant history, address her concerns, make a suitable management plan for her. Hi, I'm Dr. Ankita, one of the doctors in the clinic. What may I call you? May I confirm your age, please? I believe you have had a biopsy and you are here to discuss the report. Is that right? So, Anne, how have you been doing after the procedure? So before we go on to discussing the report, is it okay if I ask you a few questions to know more about you? Are you aware of what procedure was done, Anne? I believe you have been having heavy bleeding during periods. Can you tell me more about this? Sorry to hear that, Anne. I can see you are distressed, and I will try my best to help you. So for how long have you been having this problem? Is there bleeding between periods? Is there any pain? Any discharge? Any problem with your waterworks? Do you feel exhausted easily? Any palpitations? What about breathlessness? And I believe you have been trying for a baby and have been seeing a fertility specialist. Can you tell me more about that? Please don't mind me asking a few personal questions. Do you experience any bleeding following sex? Are your smears normal? Do you have any medical problems you are seeing your GP for? Have you undergone any other surgeries? Any medications that you are taking currently, like any herbal medications? Do you have any allergies? Don't mind me asking, do you smoke? What about alcohol? Any recreational drugs? Are you well supported at home? Any family history of concern, like cancer or clots in the family? Are you aware of your weight for height, and thank you for sharing all that information, Anne. Is there anything else you want me to know? So before discussing the report, I would like to know if there's someone here with you today. I'll be giving you a lot of information, Anne. Anne, I've confirmed that this is your report with your name and NHS number. I'm afraid I have some concerning news for you. And the report says that the lining of the womb has hyperplasia with urtypia. That means that the lining is growing abnormally, with certain cells having some abnormal changes. And I'm sorry to say this, I don't mean to scare you, but this is a condition which isn't cancer, However, in 25 out of 100 cases, there is a chance that it could lead to cancer. Also, in around 43 out of 100 cases, there may be a coexisting cancer as well. And there is also a risk around 2 in 100 of having a cancer of the ovary coexisting. So we could offer you a scan and a blood test called CA125 that could tell us the risk of that happening. And I know I've given you a lot of information. Is it okay to continue the consultation? Generally, and in a situation like this, we do offer our patients the option of removal of the womb and ovaries. I know you have been trying for a baby, so this must be a difficult decision for you. There are options we could offer you. Some women in such a situation may choose to go ahead with removal of the womb and ovaries, and that leaves the option of surrogacy or adoption for them. A surrogate is another woman who would be carrying your baby for you, and we would be referring you to the fertility clinic for a detailed discussion about this. Some may choose to keep the womb, and in that case, we could offer you medications called progesterone in high doses, and that could help to reverse the changes. It can be given in the form of a coil that can be inserted in the womb or in the form of injections or tablets. The coil would also act as a contraceptive. And am I clear so far? We would have to follow you up every 3 months to look for reversal of changes. Once that happens, we could refer you to the fertility clinic for considering a pregnancy. And I would like to tell you that having this condition, in addition to your age, could reduce your risk of conceiving. So we may have to offer you artificial methods of conceiving, like a test tube baby. After completing the family, you may be offered the option of surgery for removal of the womb and ovaries. In that case, that is, if the ovaries are removed, we would be offering you hormone replacement therapy, as ovaries produce estrogens, which is protective for your bones, heart, and brain. And I'll fix an appointment for you with my consultant as well. I know I have given you a lot of information. Here's some written information for you to read. Also, going through all this could make you feel low at times, and so we could offer you counselors as well. Is that okay? And I'll be writing to your GP as well. Thank you, Anne, for your time.